Hello, I am Christos Bergeles from University College London. I apologize that I cannot be there with you this time. However, please accept this presentation in lieu. I will present to you the simulations we have done in order to understand the biomechanical advantages of retinal surgery with flexible robots, and more specifically, the considerations that we have done in order to simulate how the vitreous humour reacts when tools are moving inside it. The goal of my research team is to develop microsurgical instrumentation that can assist with the delivery of regenerative retinal therapeutics. More specifically, we are looking at how we can design flexible instruments based on continuum robot technology that deliver therapeutics at subretinal layers. This presentation will discuss an approach to investigating the biomechanical advantages of continuum robots in vitreoretinal surgery. First, however, I would like to give you a better overview of surgery for retinal regeneration. The problem that occurs in some diseases, such as age-related macular degeneration, is that cells die. In order to restore vision, we need to implant those cells at the sites that they previously existed in. Our collaborators at UCL Institute of Ophthalmology and Morford's Eye Hospital are developing those cells as stem cell derivatives, and our job is to implant them precisely. This is a common view of vitreoretinal surgery. You can see that the instruments manipulate the membrane on top of the retina rather skillfully. This is because the vitreous humour in the eye, the gel that fills the interior of the eye, has been removed via a process called vitrectomy. Vitrectomy is a lengthy procedure that is necessary when large pivotal motions inside the eye are required. If the vitreous humour is not removed, then it attaches to the surgical tool, and any motion causes traction forces to the retina and potentially damaging retinal detachments. In the new procedures that we are envisioning, however, we will not work on the retinal surface, but rather under the retina. Therefore, is there a way to achieve laying of therapeutics subretinally by avoiding the pivotal motions? And if yes, could we do it without a vitrectomy and with continuum robots that enter retinal layers and then with a follow-the-leader approach, slowly retract? To answer these questions, we started trying to understand from a computational perspective the tool-vitreous interaction forces and how they appear in common retinal manipulations. First, we need to understand the mechanical properties of the vitreous humour and how we can create a simulated system. Then, we need to understand how tool mobility affects the forces experienced by the retina. For these reasons, we created a first approximation of a finite element model of the vitreous humour. Let's start first by discussing what the vitreous humour is. The vitreous humour is a transparent medium that fills the cavity behind the intraocular lens of the eye. It is a viscoelastic substance with collagen fiber networks that provide its rigidity. They keep the intraocular tension, but also serve as a medium. The vitreous humour is a medium through which the substances and nutrients float in the eye. The prime characteristic of the vitreous humour is also that it liquefies with time, forming lacunae of hyaluronic acid. In order to model the vitreous humour, we had to examine its composition in depth. For this, we studied the biology of the vitreous humour in the literature. Over 90% of the vitreous humour is water. However, it has very good viscoelastic mechanical properties, as we said. This is due to the double network of collagen fibrils. These fibrils aggregate and assemble in fibers which have good load-bearing purposes. Without them, the vitreous humour would collapse, and with it, the eye. Charged hyaluronic acid chains create a swelling pressure, and they exist within the collagen fibrils. These tense hyaluronic chains are making the structure be in a constant state of tension. Therefore, our simulation attempted to model the collagen fibrils and the whole tense structure inside the vitreous humour. What we want further to highlight is the age-related changes that the vitreous humour exhibits. These changes are macroscopic, and they are more profound on people that are older than 50 or 60 years old, which is the target age for age-related macular degeneration treatments. The most apparent change is liquefaction, where the collagen fibrils aggregate in order to form thicker and thicker structures. As a result, gaps appear in the vitreous humour, and then these gaps are filled with the surrounding fluid. However, it can no longer keep this tension in the structure, and this means that these lacunae are essentially regions where the vitreous humour may collapse. Another important change during the development of the vitreous humour as the person ages is that the homogeneity of the collagen fibrils changes. During early development stages, the vitreous humour is homogeneous in its structure, as you can see in the image on the left. This image on the left is the fiber orientation of the 33-week embryo, and you can see the nice and homogeneous structure. However, as you can see in the image on the right, the fibers tend to have an anterior-posterior direction in the central vitreous as the person matures. This is the fiber orientation of a 59-year-old person, and these effects of the anterior-posterior direction is something that we need to capture in our simulation. This slide shows more clearly the profound directionality of the collagen fibers. There are also varying levels of fiber concentrations throughout the vitreous. You can see that the lowest concentration is in the central vitreous. There is higher concentration in the vitreous base. This is called the basal vitreous, but the highest concentration is in the vitreous cortex or membrane. Therefore, if we want to try and be realistic to the extent possible, we need to develop a simulation framework that considers the characteristics of the anterior-posterior direction, the concentration of the vitreous fibers, and the formation of lacunae due to aging. Now let's proceed on the overview of our method. We are creating a two-dimensional simulation of how the collagen fibers in the vitreous humour are displaced due to vitreoretinal interventions. The main concept is to use finite element analysis and split the region of interest into smaller components. We use bar elements to calculate the displacement of collagen fibers due to external forces, and these bar elements will approximate the allocation of collagen fibers within the vitreous humour. Our simulation takes an MRI scan of the eye and subsequently meshes into triangles the region occupied by the vitreous humour. Each of the sides of the triangles is assumed to be a bar element that exhibits loading from the rest of the structure, which is a truss. Our goals are to understand the stiffness properties of the truss primarily, and by investigating the biological characteristics of the vitreous humour. Then we need to see how this truss deforms as tools are displacing the truss's nodes. In the image on the left, you can see the original MRI image of the eye where the vitreous humour is clearly visible. Either manually or via thresholding, we can select the boundary of the vitreous humour to serve as the anchor points of our mesh. These points cannot be displaced, they are the anchor points. The triangle sides of the mesh will then be updated to approximate the anterior-posterior directionality of the fibers and will be assigned with specific stiffness based on the aggregated fibers that they represent. Since the anchor points cannot be displaced, this is where the forces will end up being exerted. We want to identify forces that are exerted on the retina when interior nodes are being displaced, and to compare these forces with what could cause a retinal detachment. We anticipate that the forces applied when a tool pivots inside the eye will be smaller than when the tip of a continuum instrument bends for the same motion. The question is how big the reduction of the force is. As we said, we need to account for the age-related changes in the collagen fiber structure and their anterior-posterior direction of the collagen fibers. So in this step, we reduce the number of vertical truss elements in order to increase the anterior-posterior directionality of the truss structure. The amount of reduction is based on the approximated age of the model, given that directionality increases with age. What you see in this figure is how the central vitreous has the lowest concentration of collagen fibers compared to other areas of the vitreous, such as the basal vitreous and the vitreous membrane. The challenge now is to allocate fiber concentration in each of the truss's elements. In order to do this, we use the density of the fibers within the vitreous humour and the volume that the MRI slice represents. We can find the total number of fibers by using their density, which is available in the literature and could be patient-specific, the volume they occupy, which is represented by the MRI slice, and Avogadro's number, which is a constant. Now, we know the number of the fibers and we know the number of the trusses elements, so they can be distributed as a unit per meter for each truss element. Since the biomechanical characteristics of the fibers on a per unit basis are known, we can now assign stiffness parameters to each of the trusses elements and therefore fully describe the finite element model that we have created. Now we can compare straight and continuum instruments. We assume that we have a tool of 0.8 millimeters in diameter, which is 20 gauge, and this is what can be commonly used in pars plana entry arrangements in vitreoretinal surgery. We are comparing a straight rigid tool and a continuum tool whose lower one-third can bend with a constant curvature. Both tools will undertake the same motion and exert forces up to 20 millinewtons as they move inside the simulated vitreous. Our goal is to estimate the displacement of all nodes from the finite element model and calculate the forces near the retina. We can do this since we now know the truss element stiffness matrix and, more importantly, how this could affect the forces at the anchor points in the retina. These two sequences of figures show how the nodes are displaced in both of the cases that we are examining. One can see that, in the top, as expected, when a straight tool pivots, there is a large displacement of all the truss elements. On the other hand, on the lower figure, you can see that when a continuum robot flexes for the same amount of tip motion, there is considerably less displacement in the vitreous overall. With this framework, we can get first approximations and try to quantify how big these displacement differences are and what forces they start exerting on the different retinal points. This can help us understand whether we can avoid the vitrectomy when we are using continuum tools that are very precisely moving near the retinal surface. Naturally, this is the case because smaller motion will cause less displacement, but we hope that we can provide a first approximation on how much these differences are. So let's first look at the overall displacement of the simulated vitreous humour fibers. On the left, you can see the average displacement of the collagen fibers as the rigid tool moves at different levels of force. On the right, you can see the same graph, but when the continuum robot flexes its tip. Please note that the different maximum values in each of the graphs. What this comparison shows is that when forces up to 15 millinewtons are applied, and 15 millinewton forces are representative of those in vitreoretinal surgery, then the overall displacement of fibers, meaning the vitreous humour, is reduced by more or less 30%. This means that continuum tools, with their operation near the retina, cause quite reduced disturbance to the eye's overall internal structure. Therefore, even though this simulation is preliminary, it is a qualitative result pointing us to the direction of developing continuum tools when localized interventions in the retina need to be performed. Next, we will examine how forces differ when a rigid tool is pivoting versus a continuum tool moving near the retina. Similar to before, we compare how forces that the anchor points on the retina experience differ in the two scenarios. First of all, I point out that the shaded area indicates forces that, according to the literature, would potentially lead to retinal tear and damage if they are experienced by the retina. We would like our manipulations to remain below this threshold, even as the tools move in the vitreous with increased force. What this graph shows is that when continuum tools are used for the same manipulation scenario, there is a much reduced risk of causing forces that may induce retinal tear. Once again, even though these simulations are the first approximation, they offer a first tool that could provide insight in the effect that localized manipulations have on the retina. We can use those simulations as a starting point to investigate vitreoretinal surgical instruments that are flexible and therefore have the potential to be used without a vitrectomy when subretinal therapeutics need to be delivered. To summarize and conclude, we developed a preliminary model that gives us some insights on how tools interact with the vitreous and what effect this has on the retina. This sort of simulation frameworks can potentially inform the design of vitreoretinal surgery robotic instruments. It is unfortunately very challenging to experimentally evaluate those findings in a real eye, but we are working on biomechanical equivalents that may support our insights. We are also looking into clarity protocols that may allow us to remove the hyaluronic acid from the vitreous and suspend its collagen fibers into hydrogel structures that will then allow the investigation of these fibers under the microscope after fluorescence staining. Thank you very much for your attention. Should you have any questions, I am happy to try and answer them via an email. Once again, apologies for not being there with you today.